Hemorrhoids are a common health issue that many people experience at some point in their lives. But what exactly are hemorrhoids, and why is it important to recognize their early warning signs? In this video, we'll explore the subtle symptoms that often appear before hemorrhoids become a bigger problem. By understanding these early indicators, you can take steps to manage discomfort and seek medical advice before the condition worsens. Let's start by understanding what hemorrhoids are and why early detection matters for your overall well-being. Hemorrhoids are swollen veins located in the lower rectum or around the anus. They can be internal, forming inside the rectum, or external, developing under the skin around the anus. These swollen veins can cause discomfort, pain, and sometimes bleeding. Hemorrhoids are often the result of increased pressure in the lower rectum, which can be caused by straining during bowel movements, chronic constipation, or even prolonged sitting. Understanding the nature of hemorrhoids helps us better recognize their early warning signs and take preventive measures. Catching hemorrhoids early can make a significant difference in how easily they are managed. Early intervention can help prevent complications such as severe pain, persistent bleeding, or even the need for surgical treatment. By paying attention to the first signs, you can adopt lifestyle changes, improve your diet, and seek medical advice before the condition escalates. Early detection also reduces the risk of chronic discomfort and helps maintain your quality of life. One of the earliest warning signs of hemorrhoids is mild itching around the anus. This itching is often caused by irritation of the sensitive skin in the area due to swelling or mucus discharge from the hemorrhoids. While occasional itching can be due to other causes, persistent or recurring itchiness should not be ignored. It's important to pay attention to this symptom, especially if it's accompanied by other changes in the anal region. Another early sign is a sensation of fullness or pressure in the rectal area. This feeling can occur even when you haven't had a bowel movement. It's often described as a mild discomfort or a sense that something is present in the anal canal. This sensation is usually due to the swelling of veins and can be an early indicator that hemorrhoids are developing. If you notice this symptom, it's wise to monitor for other changes. Mild pain or discomfort during or after bowel movements can be an early warning sign of hemorrhoids. This pain is often described as a dull ache or a slight burning sensation. It may not be severe at first, but if it persists or worsens, it could indicate that hemorrhoids are forming or becoming irritated. Paying attention to these subtle changes can help you address the issue before it becomes more serious. Noticing small amounts of bright red blood on toilet paper after wiping is a classic early sign of hemorrhoids. This bleeding is usually painless and occurs due to the delicate blood vessels in the anal area becoming irritated or damaged. While occasional spotting can have other causes, consistent or increasing bleeding should prompt you to seek medical advice. Early recognition of this symptom can help prevent further complications. Sometimes you may notice a small lump or swelling around the anus. This can be an external hemorrhoid, which may feel tender or sore to the touch. The lump is usually soft and may become more noticeable after a bowel movement. If you detect any unusual swelling, it's important to monitor it for changes and consult a healthcare professional if it persists. A less common but still important early sign is the presence of mucus discharge from the anus. This can cause irritation and itching, and may be noticed on toilet paper or underwear. Mucus discharge is often a result of inflammation and can indicate the presence of internal hemorrhoids. If you observe this symptom, it's a good idea to keep track of any other changes in your bowel habits. A mild burning sensation in the anal area, especially after bowel movements, can be an early indicator of hemorrhoids. This burning is often subtle at first, but may become more noticeable over time. It's usually caused by irritation of the sensitive skin around the anus due to swelling or minor injury. If you experience this symptom regularly, it's important to consider it as a potential early warning sign. Some people with early hemorrhoids report a feeling of incomplete evacuation after a bowel movement. This sensation can be frustrating and may lead to repeated trips to the bathroom. It's often caused by swelling or the presence of a lump in the anal canal, which creates the impression that the bowel hasn't been fully emptied. Recognizing this symptom early can help you address the underlying issue promptly. Tenderness around the anus, especially when sitting or during cleaning, can be another early sign of hemorrhoids. This tenderness is usually mild at first, but can become more pronounced if the hemorrhoids worsen. It's important to be gentle when cleaning the area and to monitor for any increase in discomfort or sensitivity. Some people notice mild swelling or puffiness around the anus after a bowel movement. This swelling is typically temporary, but can be an early indicator of developing hemorrhoids. The swelling may be accompanied by mild discomfort or a feeling of fullness. Keeping track of these changes can help you identify patterns and seek help if needed. In addition to spotting blood on toilet paper, you may notice small amounts of bright red blood in your stool. This bleeding is usually not mixed with the stool, but appears on the surface. It's a sign that the blood vessels in the anal area are irritated or damaged. Persistent or increasing bleeding should always be evaluated by a healthcare professional. Some people experience mild moisture or dampness around the anus, even without obvious discharge. This can be due to irritation or minor leakage from the swollen veins. While it may not seem significant, persistent moisture can lead to further irritation and should be monitored as a potential early sign of hemorrhoids. A subtle soreness in the anal area, especially after prolonged sitting or physical activity, can be an early sign of hemorrhoids. This soreness is often mild and may come and go, but if it becomes more persistent, it's worth paying attention to. Early recognition allows for timely intervention and relief. Increased sensitivity in the anal area, such as discomfort when wiping or cleaning, can be an early sign of hemorrhoids. This sensitivity is often due to swelling or irritation of the skin and veins. If you notice that the area feels more sensitive than usual, it's important to consider this as a potential early warning sign. Redness around the anus is another subtle sign that may indicate the early stages of hemorrhoids. This redness is usually caused by irritation or inflammation of the skin. It may be accompanied by mild discomfort, itching, or a burning sensation. Monitoring for changes in skin color can help you catch hemorrhoids early. Some individuals experience mild cramping or spasms in the anal area as an early sign of hemorrhoids. This cramping is usually not severe, but can be uncomfortable and may occur during or after bowel movements. It's important to note any new or unusual sensations in the area, as they may signal the onset of hemorrhoids. A feeling of mild pressure in the anal area, especially during bowel movements, can be an early sign of hemorrhoids. This pressure is often due to swelling of the veins and may be accompanied by other symptoms like discomfort or itching. Paying attention to this sensation can help you identify hemorrhoids before they progress. A throbbing or pulsating sensation in the anal area can sometimes be felt in the early stages of hemorrhoids. This sensation is usually mild and may come and go, but it can become more pronounced if the hemorrhoids worsen. Monitoring for this type of discomfort can help with early detection. A subtle feeling of warmth in the anal area, especially after bowel movements, can be an early sign of hemorrhoids. This warmth is usually due to increased blood flow and inflammation in the area. While it may not be painful, persistent warmth should be monitored as a potential early warning sign. Some people notice mild discomfort or irritation in the anal area when walking or engaging in physical activity. This discomfort is often due to swelling or minor injury to the sensitive tissues. If you experience this symptom, especially if it's new or persistent, it's important to consider it as a potential early sign of hemorrhoids. Eating spicy foods can sometimes trigger mild irritation or burning in the anal area, especially if hemorrhoids are developing. This irritation is usually temporary, but can be more noticeable if the tissues are already sensitive. Paying attention to how your body reacts to certain foods can help you spot early signs of hemorrhoids. If you notice mild pain or discomfort when sitting for long periods, it could be an early sign of hemorrhoids. This pain is often due to pressure on swollen veins and may be relieved by standing or shifting positions. Monitoring for changes in comfort while sitting can help with early detection. Physical activity, especially exercises that increase abdominal pressure, can sometimes trigger mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually temporary but may become more frequent if the condition progresses. Being aware of how your body responds to exercise can help you catch early signs. Lifting heavy objects can increase pressure in the lower rectum and trigger mild discomfort in the anal area, especially if hemorrhoids are starting to form. This discomfort is usually mild and temporary, but can be a sign that the veins are under strain. Paying attention to symptoms after lifting can help with early detection. Coughing or sneezing can sometimes cause a brief increase in pressure in the anal area, leading to mild discomfort if hemorrhoids are developing. This discomfort is usually fleeting, but may become more noticeable over time. Keeping track of how your body responds to these actions can help you identify early signs. Straining during bowel movements is a common trigger for hemorrhoids. If you notice mild discomfort or pain after straining, it could be an early warning sign. This discomfort is often due to increased pressure on the veins and may be accompanied by other symptoms like itching or swelling. Sitting for long periods, especially on hard surfaces, can cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually relieved by standing or moving around. Monitoring for changes in comfort during prolonged sitting can help you catch early signs. Frequent diarrhea can irritate the anal area and trigger mild discomfort, which may be an early sign of hemorrhoids. The irritation is usually due to increased moisture and repeated wiping. If you experience this symptom, especially if it's new or persistent, it's important to monitor for other changes. Constipation often leads to straining, which can cause mild discomfort or pain in the anal area. This discomfort is a common early sign of hemorrhoids and may be accompanied by other symptoms like swelling or itching. Addressing constipation early can help prevent hemorrhoids from worsening. Alcohol can sometimes irritate the digestive tract and lead to mild discomfort in the anal area, especially if hemorrhoids are developing. This discomfort is usually temporary, but can be more pronounced if the tissues are already sensitive. Monitoring your body's response to alcohol can help you spot early signs. Spicy foods can increase blood flow and irritation in the anal area, leading to mild discomfort if hemorrhoids are developing. This discomfort is usually short-lived, but can be more noticeable if the tissues are already sensitive. Paying attention to your body's reaction to spicy foods can help with early detection. Long periods of sitting, such as during car rides, can cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is often relieved by standing or moving around. Monitoring for changes in comfort during long trips can help you catch early signs. Cycling can put pressure on the anal area and trigger mild discomfort if hemorrhoids are developing. This discomfort is usually mild and temporary, but can become more frequent with continued cycling. Being aware of how your body responds to cycling can help with early detection. Running, especially for long distances, can sometimes cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually temporary, but may become more noticeable with frequent running. Monitoring for changes after exercise can help you spot early signs. Swimming is generally gentle on the body, but some people may notice mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually mild and temporary. Paying attention to how your body feels after swimming can help you catch early signs. Weightlifting can increase abdominal pressure and trigger mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually temporary but may become more frequent with continued lifting. Monitoring for changes after weightlifting can help with early detection. Yoga is generally beneficial for health, but certain poses that increase abdominal pressure can sometimes trigger mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually mild and temporary. Being mindful of your body's response during yoga can help you spot early signs. Dancing, especially vigorous styles, can sometimes cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually temporary and may be more noticeable after long sessions. Monitoring for changes after dancing can help with early detection. Gardening often involves bending and lifting, which can increase pressure in the lower rectum and trigger mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually mild and temporary. Paying attention to your body during and after gardening can help you catch early signs. Housework, especially tasks that involve lifting or prolonged standing, can sometimes cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually temporary, but may become more frequent with continued activity. Monitoring for changes after housework can help with early detection. Standing for long periods can sometimes cause mild discomfort in the anal area if hemorrhoids are developing. This discomfort is usually relieved by sitting or moving around. Monitoring for changes in comfort during prolonged standing can help you catch early signs. Recognizing the early warning signs of hemorrhoids is crucial for timely intervention and effective management. Symptoms like mild itching, discomfort, swelling, and minor bleeding should not be ignored. By paying attention to these subtle changes, you can take steps to prevent hemorrhoids from worsening. Simple lifestyle changes, such as increasing fiber intake, staying hydrated, and avoiding prolonged sitting or straining, can make a big difference. If you notice persistent or worsening symptoms, don't hesitate to consult a healthcare professional for proper diagnosis and treatment.